Our numbers are increasing and should be taken seriously. Uh, we're going to call on all Oklahomans to take immediate action to slow the spread of the coronavirus. While we experienced a small amount of reporting backlog, which our state epidemiologist Jared Taylor will discuss in further detail, yesterday's count of 4,507 is an accurate reflection of how much this virus is transmitting across our communities. We have no reason to believe that this revised number is an anomaly, and we will continue to urge all Oklahomans to take COVID-19 seriously and act immediately to avoid large gatherings, wear a mask, wash your hands, and watch your distance from others. This is especially important as the holidays are coming up and people are going to be seeing their loved ones over Thanksgiving and Christmas, and we want to make sure everyone takes the appropriate precautions to make sure they do this safely. We know that we have the power to slow the spread, but we must all do our part by working together in order to accomplish this and keep our friends and families safe. We know the daily case count alone doesn't tell the full story, and we'll continue to look at the 7-day average of cases, percent positivity, hospitalizations, and the nature of transmission so we can see the complete picture. The numbers from this weekend add to a continued upward trend that we are monitoring closely. Additional actions will be taken should this trend continue. I ask that all Oklahomans stay vigilant in protecting themselves and their loved ones, for this is a highly contagious virus, and we all need to do our part to slow the spread. I'm now going to let Jared Taylor, Dr. Taylor, provide some details about the reporting backlog and the data trends to watch moving forward.
Basically, the process that has worked in the past has been that results come into our system in kind of this real-time basis, but it can't tally. Results that come into our system can't tally until we run what we call a data warehouse, all right? And so in this, we can build the analogy, make an analogy here to the election. But where that fails is that with the election, they're updating that on real-time basis, right? We don't have a system that allows us to do that. And so as we get results coming in and data coming into our system in real time, there's always the opportunity for mistakes or for problems to be created there. And then we come in and we do quality assurance on that data. However, we have a narrow window in which we could do that quality control. And the reporting that's coming in real time continues. And so whatever data did not get quality assured, QA'd, prior to that data warehouse build, those defects went into that data warehouse build that night.
What additional actions would be taken if the trend continues directly?
Sure. Just for everyone, we have different actions, potential actions that are tied to the different tiers of our surge plan. And so the hospitals are enacting some of those. They've already started doing different things that they need to do in order to ensure that the capacity is there. As far as mitigation efforts go, there are multiple things that are discussed multiple times a week, basically daily, with the governor and his staff, and they're looking at the metrics very closely and are considering. There's nothing off the table. They're considering all of them. They're looking at them all and as potential actions.
What are the options? Like, what could hospitals do? What is the governor considering? Is he considering a statewide mask mandate? Is he considering changing his messaging on masks? Like, what specifically is he considering if we're having this really serious spike?
Well, I say that those questions come up. It's our job to discuss all of those things. When we're talking about that, we're talking about closing of restaurants, limiting capacity restaurants. We're talking about closing bars, limiting hours on bars, limiting capacity, limiting large gatherings, limiting indoor sporting events, or limiting the number of spectators or banning spectators from indoor sporting events. I mean, we talk about all of those things that you can hear as far as mitigation efforts. And it's our information to present that information, and it's his job to make the tough policy decisions.
So can you please tell us how much of Saturday's case numbers might have been from a backlog? Dr. Fry, you said that number is not an anomaly, and it's, it's a sign of more community spread, but it seems like quite a significant jump from Friday's numbers.
Right. I think Jared probably has that exact number. I think it's 429 cases, but that this was an artifact of us moving to our new Spring ML system, Google-based system, because it's requiring labs to report in under certain, with certain parameters in order for it to come in electronically. And there were some labs that were having difficulty with that system, and that's what caused it. But